ABC4 Investigates is following allegations of systemic problems inside a Central Ohio hospital. In recent months, Jamie Ostroff has exposed accusations of sexual misconduct against two doctors at Adena Medical Center and how hospital administrators reacted to those claims. Well, tonight, Jamie brings us new concerns, and this time we are talking patient care.
Yeah, I have learned from sources inside the Chillicothe Hospital with direct knowledge of its inner workings that on as many as 3 patients, a cardiac surgery was performed by a doctor who was not properly credentialed. The transcatheter aortic valve replacement procedure, also known as TAVR, is a relatively new surgery. It involves replacing a damaged heart valve without cutting open the patient's chest.
Highly specialized and complex, yes.
This person with direct knowledge of the situation at Chillicothe's Adena Medical Center spoke to me on the condition that I keep them anonymous, but they chose to take the risk of speaking up.
A general concern about safety of the patients at the hospital.
TAVR is one of many procedures that requires the proper credentials. Credentialing is an essential part of our healthcare system, allowing insurers to know that they are paying for the right providers to serve their customers. Without credentialing, the claim would be denied. As the largest payer for healthcare in the U.S., the Centers for Medicare and Medicaid Services sets those standards. Does Adena Health perform TAVR procedures?
Yes.
And are the doctors who perform them credentialed to perform them currently?
Yes.
Were they previously not credentialed and performing those surgeries?
It involves 2 doctors for the procedure, and one was credentialed and one was not at the beginning of the process.
Are you able to tell me how you were able to get that information?
I saw it.
It's documented?
Yes.
Within Adena's internal systems?
Yes.
I independently confirmed what this source saw with another person who has direct knowledge but declined to speak on the record. Even though both of Adena's doctors who perform TAVRs are currently credentialed, says the source, the fact that one was not before performing up to 3 TAVR procedures in March of 2022 raises concerns.
My concern is not one of one specific case, but more of a process that needs to be in place to ensure the safety of all patients for all types of procedures. And if we skip parts of the process, we can put people at risk.
This person isn't the only one with concerns.
A lot of why I'm sitting down and talking with you is because if I know something and I don't say something, then I'm complicit in anything that happens beyond that, if that makes sense.
Reverend Dr. Jason Link voiced similar concerns directly in an email to Adena's executives and board members. Link is the pastor at First Presbyterian Church, Chillicothe, one of 8 remaining corporate member churches that founded Adena Health in 1895. The churches still play a role at the hospital. Each appoints one member to the 15-seat board, and the pastors must sign off on any mergers or changes to hospital regulations.
I talk about it as we can almost be the voice for the greater community. You know, where the board members, they've got to look at what's best for Adena Hospital. The pastors have this opportunity to take a broader look for what's best for the whole community.
A response from Adena Communications to Link's email said of the 3 TAVRs performed on March 1st, 2022, quote, medical staff leadership determined that the surgical privileges for TAVR should be called out as additional privileges to better outline the distinction from core privileges. We believe this change may have caused some confusion. The message goes on to say Adena did not bill for the procedures in order to ensure compliance. The source confirmed everything in the email is true. They do not believe any patients were harmed. Are patients safe going to Adena for surgery?
Yes.
Now, Adena's leadership flat out denies these allegations, telling me, quote, the team of cardiovascular physicians who performed Adena Health's first TAVR procedures in March of 2022 were appropriately credentialed to do so per all regulatory requirements and were accordingly privileged by the organization to perform the respective disciplines essential to the procedure. Claims to the contrary are patently false. A spokesperson did tell me there is documentation to debunk the claims you just heard, but the hospital cannot legally show them to me. It is important also to point out that privileges are different from credentials, and by all accounts, these doctors do have the appropriate privileges. Jennifer.
All right, Jamie, thank you.